third world countries. It's real. So when we talk about intimate partner violence, we are talking about something that has a possibility to touch each and every one of us. Definitely touching someone that we know. The reason why I can say that today is because 1 of 3, that's right, the research says 1 of 3 women, 1 of 3, that means a third of this room, ladies, a third. 1 of 3 will either be raped, experience physical violence, or emotional abuse. 1 of 3. I don't know about you, but that carries a high weight. 1 of 3. And guess what? When we talk about intimate partner violence, do you realize that our children, the young lady, I thank you for recognizing that our youth are at risk, because that's where it starts. That's what the evidence and the research says. That's what we're seeing. That's where it starts. Not only is that where it starts, but guess what? It doesn't matter what your culture is. It doesn't matter what your religion is. Nor does it matter what your social economic status is. Because for those that are incredibly wealthy and those that experience poverty, 1 of 3 is at risk. When we think in terms of intimate partner violence, it's like peeling back the layers of an onion, right? Because in reality, there are layers. Because first and foremost, there's the individual, right? There's the individual like me. Who am I? What makes Benite tick? Well, the first rule of thumb is learned behavior. What is learned behavior? It's what I've seen my family do. It's my core values. Core values are things like honesty, integrity, being family-oriented, going to church on Sundays. Those are core values. Core values is not what's easily shook. But at the end of the day, but we also have those other things, right, that impact our security versus insecurities in relationships. Self-esteem. Good self-esteem, high self-esteem, low self-esteem, all of those things that influence our self-esteem. When we look at it in terms of the individual, do we use drugs? What about alcohol? Do we love ourselves? How about this one? Can you really expect something from me if I've never been exposed to it? That's the first level when we start talking about intermittent partner violence, and that's the individual, what he or she's bringing to the table. Because I also failed to mention, for the men that are in the room, you too are at risk for intimate partner violence. The second thing happens to be the relationship. You know, when you're bringing 2 people together, right? And it really doesn't matter. It doesn't matter if you are in a heterosexual relationship versus a homosexual relationship. Your preference really doesn't matter. Your age really doesn't matter. What matters are 2 people, 2 individuals coming together, right? And so when we look at that, we start thinking about, going back to the learned behaviors. And guess what? If I'm in school and I'm walking down the hallway and the guy likes me and he pushes me, that's a red flag. How often do we tell our kids, oh, the neighbor's pushing and joking and calling you all sorts of names. Oh, he likes you. Well, no. That's what we used to think. But today is a different day. The research tells us otherwise. So when we bring these 2 individuals together, one of the red flags that sets us up for intimate partner violence, right? Codependency. How many of you ever heard that term? If we were to be brutally honest, nobody would ever fess up. I'm a codependent. Right. Because you know that you know that you know. That means that you are so into that individual, that relationship, that you would what? Not put yourself first. It's you. It's you that you're harming. When we start talking about codependency, Some people want to be in relationships just because they don't want to be alone. And I'm not here to knock it. Okay? I want to respect everybody's right to be in a relationship, what you're doing, your choices in life. But there are certain things that put you at risk for being abused. And if there's one thing today that we all need to take away from here, is guess what? We want to promote healthy relationships. So when we start thinking in terms of going back, the individual factor, that's the first layer. The second layer being the relationship factor. Again, I'm going to say this. Stop expecting people to do things that they've never been exposed to. If you're aiming for a healthy relationship, and if your parents have never modeled it because it wasn't modeled for them, pause. If you have teenage daughters and you want them to be in healthy relationships, but you have never been in one, pause. Pause. I tell you to take the pause because the first step, you gotta do some research, you gotta figure it out, you gotta get some mentors, you gotta get someone to help hold you accountable to make sure that you stay on that pathway, right? The third step, or the third layer, is community. And then the fourth being the bigger society. We see community as, I was sharing today, earlier, what I'm greatly concerned about is how we desensitize so many things. If you look at television on a day-to-day basis, if you look at the news, we are completely living in a community, a local community that's desensitized. And violence is almost embedded in our day-to-day culture. If you look at the news, somebody's getting shot, bang, bang, shoot them up. If you look at the news, there's a robbery, there's just violence. But then outside of that, if you go back and you start looking at Facebook and what's posted on Facebook, sometimes there's that violence that's there. Books that we read, things on television. Why am I saying all this? I'm saying it because to some degree we have to be careful and limit what's coming in. On a global perspective, violence, again, we see violence everywhere. We see violence everywhere. There are countries that are fighting. There are, over in the Middle East, there are women who don't have a voice, who will get slapped and beaten just for not having on the appropriate attire. We see violence on every level. So here goes. You have the individual, you have the relationship, you have the local community, and then you have society. So when you start putting all those things together, I'm pretty sure that I know what I'm talking about, which simply says that we have a real issue. We have a significant issue, and yes, it's a public health issue. I'm going to tell you why it's a public health issue for us. It's, excuse me, it becomes a public health issue for us because guess what everybody's saying? Well, those of you in healthcare, you can see it first. And to some degree, you're absolutely right. We can. We see the frequent flyers coming in with the general aches and pains. We see that individual coming in with frequent STDs, sexually transmitted diseases. We see the frequent flyer. What is a frequent flyer? A frequent flyer is someone that everybody in the system knows. We see, and see, here it is. When those individuals are coming in, they're coming in for help. So what the government's now saying is, we own a responsibility. And that responsibility is to raise awareness. That responsibility is to educate, to educate, to educate, to educate. Because once we begin to educate, and it starts at home, it starts with our youth, because yes, the research does say that's usually where they first experience intimate partner violence. as being a youth, an adolescent. But once we begin to educate, then we know that we can no longer say, well, you didn't know. But now I can say, they just don't know. Wait a minute, time out. So that's why we're really here today. We're here to promote awareness. We're here to say, hey, let's grab these tools to put in our toolkit that we can share with others. Because the truth of the matter is, influence of abuse can be lifelong. There are different layers of abuse when we start talking about intimate partner violence. Different layers. For example, there's a sexual, there's a coercion, being forced to do something you don't want to do, right? And whether you're being forced to do it or your self-esteem is so low that you just don't know, or you just don't, your thought process is so full you can't make a decision to run when you can run, right? So what we see the person in their entirety. When they come into us physically beaten with cigarette burns, I can see that readily, and I then can say, tell me about the burns on your arm. Never make a judgment, never ask directly, but I can say, tell me about the bruise. What's this bruise? They probably didn't think I was going to see it, but I'm just starting the IV. Who am I, right? You got to get undressed, and all of a sudden, you're exposed. But at the same time, when I'm raising the questions, I have to be careful, and I have to understand the dynamics. What are the real dynamics? When we start talking about being in an unhealthy relationship, one that's wrapped around violence, most people don't want to be in that situation. And guess what? Here's the most disheartening thing for Benite as a healthcare provider. Only 17% of African Americans, 17% are willing to report it. So when I see that individual coming in, when I see those cigarette burns, when I see, how many times am I going to give you this shot? All I can do is do my part and say, tell me about this. Most states, there is no mandate for us as healthcare providers to report it. That blows people away when I say that, but that's truthful. Because the reality is, I've got to send that person back home. Do you know the number one day of the year when we see intimate partner violence the most?
Super Bowl.
Thank you.
Wow. Wow.
So let me just tell you what the ER is like on Super Bowl Sunday.
Wow.
So for Super Bowl Sunday, it's quiet. Let me say that again. Super Bowl Sunday, it's quiet. Unless we have some residual from the night before, bang, bang, shoot 'em up. And I want to be honest, I love what I do, and I have nothing but respect for my patients. But when I use this terminology, it's not minimizing what's happening in the community, okay? But on Super Bowl Sunday, we're quiet. And then as soon as the game is done, across America, we get busy like never before. That's something to think about, now whether or not, going back to that relationship factor, because the other thing that puts stress on a relationship, if you're gambling and you don't have the money, right?
Wow.
Or if you're involved in a relationship and he or she is cheating and have multiple partners, there are lots of factors here, right? But that is the number one day out of 365 calendar days that we see intimate partner violence escalate the most. And guess what? And when those women come in and when those men come in, we understand that our job is to treat them with dignity and respect, because every adult has the right to choose. Let me say that again. An adult has the right to choose, and at some point, they will choose, but they have to build their confidence up, they have to build their resources up, they have to get a support system in place, because it's not that easy. And one of the things that we see with intimate partner violence is when the resources, the monies are being controlled. So our job is to stabilize them. Our job is to love them and make sure that they feel their worth at that moment. Our job is to send them to a safe place. So we don't get the opportunity to say, you better leave him. Who am I to say that? Because at the end of the day, here's an amazing statistic. For those people who want out, they've got to have a safe plan. The research tells us that within 1 year, that's when we see death. For those individuals who've chosen out to leave, that's where we see it the highest in that 1 year mark. So we know that our job is to take care of them again with dignity and respect, but we also know that discharging them to a safe place. And who am I to define safe? Because again, I go back to the first factor. We're all individuals. We're here collectively together, but we're all individuals. So when we start thinking about the influence of abuse, it does wear and tear. Make no mistake about it. This is what we're seeing. We're seeing young people with high blood pressure. We're seeing, when I say young, who would have ever thought that we would see so many African Americans coming in with strokes and their age is under 40?
Oh, wow.
You know why? A couple of reasons. There are lots of reasons, okay? Lots of reasons. But the reality is, number one, I love someone said the word suffer in silence earlier. Remember I said only 17% of us report? We suffer in silence to the degree that we don't get help when the help is readily right there in front of us. And that's on all levels. We, for whatever reason, suffer in silence. And you know what else we do that no other culture has been known to do? And I'm going to make sure I emphasize this point, because this blew me away when I read the article. But guess what we do? We fight back. That's not strength. You know why that's not strength? Because in the moment like that, things escalate. People get put in body bags. Just like that. They wish they can go back and turn the clock back. Don't fight. Don't fight back. Don't fight back. You can't get that time back. Where's the strength? The strength is saying, talking to yourself in that moment. Whatever I gotta do to get through this moment, let me get through the moment. Let me get, who am I gonna call? How am I gonna get out the house? But don't fight back. And don't fight back in the kitchen. Don't fight back. So again, what are we to do? We're to educate, educate, and educate. It starts at home. If I was to ask you, how many of you, how would you define a healthy relationship? That's relatively a new buzzword, but it's a real word. It's one that we all want to embrace, right? And not just with our intimate partners, right? But with our girlfriends, with our family members. Why do we want to embrace healthy relationships? So I'm just curious. This is where we get an opportunity to interact with one another. So what are some things that we see in a healthy relationship? Anyone, someone. Don't leave. Yes.
Loving, caring, and respect.
Love, caring, respect. Yes.
Trust.
Ooh, I love it. Trust.
Communication.
Yes. Communication, trust, loving, caring. Yes. The consent is consistently established. Did I hear you correctly? So basically you're saying that you're talking through things. You're hearing one another, you're supporting one another, and you both are in agreement, right? Nobody is being forced to do anything. And in that situation, those two people are doing what? They're encouraged to be themselves. So we see and all of you are correct, by the way. There's trust, there's communication, there's nurturing. The biggest thing there is emotional support. Nobody is tearing you down. There's accountability. So let me tell you what accountability looks like in this healthy relationship that I have with Jan House, right? So Jan knows my mom. So if I didn't do a good job today, Jan would probably call me. She wouldn't tell me, she would call my mom. But I love that accountability because it'll get back to me, right? So, I had to put a little bit of humor in this. But in hindsight, when we embrace healthy relationships, guess what else you have to bring to the relationship? You have to bring boundaries. So I'm gonna ask another question. How many of you are comfortable setting boundaries? Because that's a real question. Because, sometimes if we don't have, depending on the relationship, we can't say no. But setting boundaries is real. Learning to say no. Learning to say, I'm uncomfortable with this discussion. I tell you what, you go ahead and have a great time. I'm gonna stay home. Something just doesn't feel right tonight. Or how about this, on the phone? You know what, let me call you right back. Is that not a good way to exit? Let me call you right back. Right way, you're not hurting anybody's feelings or, Now I'm not saying you'll never have to call me back, but what I'm saying is, I'm just simply saying boundaries, right? So all of this matters. And I'll leave you with one last thing before we open up the floor. Here's the deal. I said earlier that 1 of 3 women experience intimate partner violence. I'm not going to ask you how many of you have been in that bucket. I will be bold enough to raise my hand in complete transparency. And if I've learned nothing else, I've learned how to take a pause. What is the pause? The pause can represent a lot of things. The pause is me taking time out. For me, why is that important? It's important to get back in contact with who you are. Who are you? Your family miss that person. Your children miss that person. Who are you? Because once you've been living in chaos, it erodes at the person that you are. And it takes time to heal. Restoration is a process, right? It's a process. It doesn't happen overnight. So you have to find ways to nurture yourself, self-care, to love you. Because here's the other thing that I need to emphasize when we embrace healthy relationships. You have to love you. If you're not comfortable being by yourself and enjoying your company, why would anyone else want to be hanging out with you?
That's right.
So when we start talking about leaving the intimate partner violence behind and moving forward, because guess what? In life, we all have to keep moving forward. And on that pathway of restoration, on that very pathway, we have to understand it takes time. If you need to pull back to nurture you, if you need to pull back and just cut the phone off and all you can do, excuse me, all you can do is go to work because the bill's got to be paid, guess what? That's what you do. Your family is going to be there, your friends are going to be there. The other reason why you need to pull back, because guess what? You got to minimize all of this This is all the voices. You gotta heal. You gotta get this under control. This is the mind. So in that process, I wanna just kind of share a tip of success. And it's called the law of displacement. Anytime you're trying to get rid of a bad habit, right? Whatever that bad habit is, you have to put something else in place. So if you're having bad thoughts, you want to start having thoughts of gratitude. If you're having negative thoughts, you want to have positive thoughts. If you stop smoking, you want to exercise. You got to do something because when that anxiety kicks in, right? So when you are leaving an unhealthy relationship, you want to focus on just the opposite. You want to be around people who love you. Let me say that again. We go around people who celebrate you. There is a difference between being celebrated and tolerated. You know, in the workplace, we tolerate one another because we're part of the team, right? But you want to be able to transition. You want to be able to self-care, boundaries. You want to be around positive people. People that are going to pour into you, people that are going to encourage you, people that are going to help edify you and remind you who you are. And it takes time. And if you want to attract a healthy partner, take time and pause. I'll open up the floor for questions.